Welcome to the Executive Innovation Show podcast, where we bring you real executive conversations with industry game changers and thought leaders. We ask the questions you're thinking, what you're scared to ask, and we make your brain hurt afterward. With your host, Carrie Chitsey Wells, co-founder and CEO of One Touch Video Chat, live video interviews, and the nonprofit Humans Helping Humans.
Hello, everybody, and welcome to today's podcast brought to you by One Touch Telehealth. We're going to be talking about improving health outcomes through Consult Pharmacists. Got two amazing guests on the show today, going to provide a lot of insights. Our first guest on the show is going to be Chad Worz, who's the Chief Executive of the American Society of Consult Pharmacists. He's a pharmacist himself. Also has been working on managing medications for people his entire career. Later in the show, we're going to be talking to Ashlee Klevens Hayes, who's the founder of RX Ashlee. She's also the University of Southern California School of Pharmacy career strategist and is the host of RX Buzz podcast, also affiliated with the Pharmacy Podcast Network, who's consistently ranked top 30 business podcasts on Apple. Chad, welcome to the show.
Thanks. How are you?
Great. Well, you started your career as a pharmacist in the long-term care setting, have done some amazing stuff over the years before you came to the American Society of Consult Pharmacists. Tell everybody a little bit about how your journey as a pharmacist prior to where you are now, and some of the tech innovation and fun things you've done in pharmacy.
Well, I'm. It's kind of funny. I don't know if everybody's story as a pharmacist starts this way, but I feel like it's a serendipitous story that defines how I got here. I'm an old school PharmD, so I graduated back when you could get a BS in pharmacy after 5 years. But when I went into pharmacy school, I just was in love with the profession, so I continued on and got a 2-year post-BS PharmD. So I did in 7 years what everybody now does in 6 years. So they're much faster, more efficient than I was back then. But I was very motivated to, at the time we called it cognitive services, was to provide something beyond just the medication product and work in areas where we could help patients and educate people on the best ways to manage and use their medicine. So I went right into long-term care practice, which, 20 years ago, you got two reactions to that. One was, wow, you're so great for giving up your career and working with old people. Or you got you must have finished last in your class, because nobody wants to go work in nursing homes. They smell. It's just not a place that people desire to work.
Right.
So, I got started in long-term care at that time, really because that was the opportunity to jump in and do cognitive services and perform more than just dispensing medications and get into the side of pharmacy that is more management, working with different disciplines, working directly with patients to try to help them really manage their meds. And I think for 20 years, I spent most of my time looking at individuals on multiple medications and trying to figure out how to get them managed on fewer medications. So the whole drive of deprescribing and polypharmacy that's kind of hitting today has really been smoldering for about 20 years. And people are looking for people to come in, look at their medication regimens and find ways to improve them from a burden standpoint or a side effect standpoint. So I think we're really at the tipping point of where pharmacy and pharmacists can play a significant role in helping people.
Great. So you guys have really been working on improving health outcomes for patients, education on medication management for the pharmacists, especially in the senior arena, which you're really passionate about. Tell everybody, what are percentage of the medications? We've got this aging seniors right now. There's a lot of talk about seniors wanting to age at home, the rise in baby boomers. Where's the medication today of what percentage is going to seniors? And is that going to dramatically change over the next 5 to 10 years? What are your thoughts on that?
Well, I think a kind of back to what I was saying about deprescribing and polypharmacy, we have a exploding group of individuals over the age of 65, and we're right at the beginning of that. So if you look back, 65, 70 years, you'll see that we're right at the end of one of the lowest birth rates in this country, and we're starting to climb this almost dramatically straight up curve of baby boomers, where the birth rate exploded in the country, and we have this giant, however it's characterized, silver tsunami that is coming that consume a lot of healthcare, including medications. So when I look at where meds are going, and part of the reason I took the role at ASCP was because I see a real opportunity for pharmacy and pharmacists in the next probably 5 to 25 years, because we have about 50 million people over the age of 65 today. In 11 years, by 2030, that number will be close to 74 million. And by 2050, it'll be in excess of 90 million. So as that population grows, some of what we're doing to manage them will continue to grow. And right now, the older adult population over 65 consumes 39% of all medications in the country. So they're already the highest consuming segment, which is somewhat intuitive. I don't know if it's intuitive that you would expect them to consume that many medications, but that's the number. And that number we anticipate will continue to at least stay at 40%, maybe go up a little bit as we try to strategize around reducing polypharmacy and med burden, but at the same time, being faced with new innovations and new medication products that come out that might have a real role in people that are up in their years and have multiple comorbidities and have multiple needs for medications. So I don't see anywhere for the healthcare system to go other than up as it relates to medications in the older adult population. And I think that's where the real opportunity is for pharmacists to get in front of patients and start cleaning up and managing these trail mixes and cocktails of medications that people are on, to try to hold the line in terms of medication burden and try to make sure people are on the least amount of needed medications so that their quality of life is high. They're benefiting from the meds that they need, but they're also not being hurt by medications causing side effects or adverse events that then may require additional engagements with the healthcare system, hospitalizations, and maybe even the addition of more medications.
Yeah, and I think, if you look at the trickle effect of the numbers that you just said, as you look at, this huge number, I love the silver tsunami. I'm going to have to steal that from you. And I know I was going to say, I know you stole it for somebody else, so I'm not really stealing from you. But you have this silver tsunami that's going up, right? The rise in caregivers even multiplies those numbers dramatically, right? So you have your Gen X's that are now taking care of mom or dad. They're taking care of, getting them to all these appointments. Maybe they're, managing their home health. They're picking up their scripts. They're doing all these kind of things, right? And so you have these Gen X's that also, are trying to help their parents that are super smart, savvy, so forth. And really the pharmacist might be the only one that has the true picture into all the medications. As I don't know, I think the average number of medications for seniors is, really high, like 7, 10, even higher than that, right?
Yeah, it depends on setting, but yeah.
Yeah, so if we look at chronic care, it could be 15 plus, but you have these caregivers that are now also looking to the pharmacist to say, help me understand these AMs and PMs of this medication. And, we've got 2 high blood pressure medications here. Is this right? And, you get discharged from the hospital and you're so confused. And it's really, making that role of the pharmacist, much more critical. And, as we talk about that role of the pharmacist, of the filling scripts and doing the auxiliary services and taking, calls from patients. And now you have the calls of caregivers, everybody's pulling their hair out, right? So explain to me the difference between the consultant pharmacist and the retail. What does that day-to-day role really look like? The setting, how is that different between those two roles? Is there, more similarities than differences, more differences than similarities? Explain to everybody kind of the difference of the two.
Well, I think, at face value, a pharmacist is a pharmacist.
Right.
A pharmacist that works in a retail setting has the same basic skill set as a consultant pharmacist has. And I think that's been somewhat, kind of a misnomer over the years, that to be a consultant pharmacist, you had to do something extra. You had to get a certification, or you had to have so much experience. And to some degree, that's true, but that's true with anybody's role or responsibility or job. But when you look at the difference between a day-to-day basis, what a consultant pharmacist does versus a pharmacist that might be working at a corner drugstore or at a retail setting, a consultant pharmacist is not handling medications. So a consultant pharmacist in its traditional sense, and this subset of the profession started about 50 years ago. In fact, it's the 50th anniversary of ASCP this year. And what it started as a pharmacist going to a nursing facility, which back then a nursing facility looked much more like a rest home than a acute rehabilitation center, which is what it looks like today. And they would go in there and they would sit down with patients and with the medical records, and they would review somebody's medications, and they would look at the charting from the nurses and from the physicians, and they would figure out if any of those medications were causing problems. And then they would leave a note for the nurse or the physician that said, hey, we think this medication is causing this problem. Maybe you should switch to this medication, or maybe we could stop this medication or lower the dose. So what a consultant pharmacist is doing is really looking at focusing on the medication list, while at the same time kind of taking in what the other disciplines have contributed to the healthcare record and coming up with strategies to improve it, to improve that medication regimen. Now, again, traditionally that's done in a skilled nursing facility. That's where pharmacists are required to be by the Centers for Medicaid and Medicare Services. But we've also seen them in the last 50 years grow out of just a nursing home and into assisted living communities. They're very active in transitions of care, so people moving from the hospital setting to the home setting, and they're starting to be embedded in physicians' offices as those physicians' offices feel that their population is predominantly older adults on multiple medications. So the consultant pharmacist in those settings are really not handing you a prescription bottle. They are looking at your records, and then they're having a conversation with you or your caregiver about what the best path is from a medication standpoint for you or your loved one.
And is that role typically behind the scenes, or is the consultant pharmacist actually talking to the patient in most cases today?
I would say it's mixed. I mean, I can't say that it's 100% one way or the other. Sometimes in a nursing facility setting, you're not, and we're seeing this in nursing homes, and it's part of this conversation, and you brought it up with aging in place. People want to live out their lives at home. They don't want to move into even assisted living environments, and certainly they don't want to move into skilled nursing environments.
Right.
But the number of skilled nursing home beds has not increased in 20 years. So It's a flat line. And if you look at that flat line in contrast to the growth in population, what you're seeing in nursing homes is that only the very demented, or only the very difficult to manage from a psychosis standpoint, only the people that are leaving the hospital with so many care needs are ending up in the nursing home. And sometimes it's just for a short period of time versus for the rest of their life. So a lot's changed. And when we look at how pharmacists are engaging patients in those settings, if you're in the nursing facility for 3 weeks and you had a hip fracture and you've got diabetes and COPD, this is an opportunity for a pharmacist to sit down with you while you're sort of captive, go over your medications, and make sure when you go home and you grab that purple cylindrical inhaler, that you actually know how to use it, because it's going to be the thing that possibly stops you from going back to the hospital and re-entering this cycle. So pharmacists are growing in terms of their direct patient contact. Obviously, in retail settings, there's a lot more direct patient contact. So as we get better at delivering these different solutions to patients beyond just handing them the product, we are engaging more patients face-to-face, and certainly engaging more caregivers face-to-face.
So as we look at the consultant pharmacist role to, really provide that proactive healthcare, improve health outcomes, especially for folks that have, prescription adherence issues or medication management, or, to your point, they may not know how they're maybe using an inhaler for the first time, or, it's the first time that they're using insulin or whatever it may be. And we've got, the payers, pushing folks out of hospital sooner now to go to acute care or a skilled nursing facility for a short time. And, maybe they go on to home health a couple of days a week or whatever it may be. But to really prevent that value of care model of patients going back into the ED, and as you said, just going that cycle, spinning it over and over and over, with new technology innovation, whether it's, the adherence applications that are out there that notify caregivers and can notify pharmacists that patient, didn't take their 2:00 medications, and, or it's been 2 days since they've taken this medication, whatever it may be. And you have TelePharmacy that's now affordable, down to single pharmacists that, can talk to patients through their own phone, through video, and even service, skilled nursing, long-term care facilities, things like that, to be able to video with the patient and not be driving to facility. Where do you see that headed in that relationship with the consultant pharmacist and the individual patient, as well as where do you see that with the pharmacists and the nurses or the doctors at those facilities? How does that change over the course of the next couple of years with technology from your perspective?
Well, the technology question is always so broad. And when you look at things from a technology standpoint, they move so quickly. And I think pharmacists have to be pretty clear that there are opportunities out there as it relates to applying technology to their practice. So, at ASCP, we're a professional organization. We represent these pharmacists that work with seniors. We have a website that's called helpwithmymeds.org that anybody can go to and link to a consultant pharmacist. That's technology, but that's pretty pedestrian technology. What I think pharmacists need to be thinking about is how do we use telehealth and telepharmacy applications to engage patients. We're all worried about, Amazon entering the pharmacy space and what that means. They're going to drone prescriptions to your front porch, but there's a component of that is still the pharmacist, whether it's a consultant pharmacist or a traditional pharmacist, where you've got to have that engagement with the patient. And what does that look like? And pharmacy is unique in the sense that we don't generally physically assess patients. We take data and information and we look at med lists, and that's all something that's easily translatable over video, over chat, in a digital format. Right. So we really need to be looking at that. And I think, I could go 1,000 different directions with how pharmacy is going to be changed by this kind of technology. But I don't think we're very far away from, instead of the corner drugstore being sort of that romantic, antiquated model that everybody loved from the 50s and 60s, where they could walk down and talk to their pharmacist and do that old school thing. I don't think it's far off where a pharmacist might come to your house, at least initially, talk to you about your medications, arrange the drone drop from Amazon or whoever, and then periodically check in over your smartphone or over your computer at your house, and have that face-to-face communication while at the same time coordinating your medication. So a pharmacist might become their own sort of pharmacy minus the bricks and mortar in the future. Now, will that happen in 5 or 10 years? Hard to say. But I do think that the importance of delivering the information that a pharmacist can do to help patients is going to drive the utility of that technology. So technology is always just a vehicle for, an important service. And I see that pharmacy and pharmacists can definitely engage with this digital technology to improve the lives of patients. I mean, think about how many, you buy a new app for, even $3 on your smartphone, and the first 5 minutes of that app is a tutorial on how to use that app.
Right.
You go to the pharmacy and you get a $600 drug, and sometimes you don't get any instructions on how to use it. So how can we embed, using technology so that when somebody quote unquote buys a product, in this case, gets a new prescription filled, they get access to 5 minutes, 10 minutes, 15 minutes of a pharmacist going through that medication and making sure they understand how it works and the best ways to take it and all the intuitive things that pharmacists can bring as it relates to making sure med is successful. And I think that's what the future really looks like.
Yeah, and I think it's, just thinking about, my own scenario of being a caregiver for my father who has, multiple chronic conditions. I mean, when he goes into the hospital, I literally have to print a medication list, right? It's not something that I can just like rattle off like a normal person, like, oh, he's, taking these 2 medications, right? And so we literally travel with this medication list, right? And then every time he gets discharged from the hospital, there's a change to the medication list. And so then you go home and you have this, I joke, this got this huge basket of medications, right? And he's, I'm sitting there looking, going, okay, so we had to pick up this new script. Like, so are we, which of these prescriptions am I taking out? Like, it's the perfect video telepharmacy scenario of now I've picked this up. You may have told me something upon, the doctor may have said upon discharge, like, hey, here, you're going to need to pick up this new prescription. And, but, I'm worried about, everything on the discharge of, gathering clothes and, doing all this stuff, right? That's the last thing I'm really listening to. But then you get into the home setting, right? And you get down to the brass tacks, and that's where, it's so critical that if you could really video, because, when I leave the house as the caregiver at the end of the day, if I'm not actually pulling the script and, throwing it away or disposing of it, he's going to end up taking that script plus the new script. And, it could be a recipe for a bad cocktail that could end him up, right back in, the emergency room or whatever it may be. And so I think I think the pharmacist is going to be playing a big role in the future of what all our, MCOs, ACOs, and FQHCs are really trying to figure out with these chronic care patients that are, driving, a lot of healthcare costs because there hasn't been that proactive care, within the system historically.
Yeah, I mean, I agree. I mean, we use that identical example over and over. And I think what people forget is that when you are pseudo-related to the healthcare industry, or you have a family member that's in the healthcare industry, you're so much more fortunate than somebody that doesn't have that, because you have somebody thinking about what's the impact. You described it perfectly. You printed out your dad's med list. You got the med list when he left the hospital. You're engaged in that process. But there's a lot of people out there that A, live alone and don't have that support structure, and B, don't have somebody that can articulate healthcare concepts. Right. So what happens to them when they get home and they have their 14 new amber vials and they're looking at their 21 old amber vials? They have no idea if they take all of that, none of that. They left their house on a drug like quinapril, and they are back and they have a new drug called lisinopril. And even though they rhyme, they don't know that they're the same or different. They don't know if they should be taking them or not taking them. So there's a lot of risk there. So I agree with you. I mean, there's a lot of opportunity for pharmacists to put themselves in between that scenario to give people the help that they need to manage that transition.
And with the payment model the way it is with the pharmacist, retail model is a little bit different. Who pays for that? I mean, from a pharmacist perspective, that is providing, skilled nursing, acute care, whatever, is that just an extension of those services, or is, do the MCOs and ACOs need to get involved and, there's some of that's reimbursed for today, or where do you see is that a mismatch today? Does there need to be more reimbursement there?
There does. I mean, I think if you ever want to stand in front of a group of pharmacists and get them all excited, is you say Amazon, opioids, and reimbursement. I mean, those three words, and everybody kind of goes crazy. But reimbursement is an issue. We've seen in the last year the current administration trying to come up with ways to reduce drug prices and bring transparency to the process. I'm not sure that's going to go very far. I don't know what that's going to do, but from the perspective of the public and pharmacists, I think it's been good to understand how it works, because at the end of the day, the reimbursement for services that come alongside that product have to cover some of these things that we're talking about. And there are pieces of it in places. There are chronic care management codes that a pharmacist can bill through a physician and be reimbursed. There's the nursing home model, where the nursing home is allotted dollars to then in turn pay for consultant pharmacist services. There's the just the value add concept, where an assisted living facility that doesn't have a requirement for a consultant pharmacist might feel like they do a better job marketing and caring for their patients if they employ a consultant pharmacist in some way. You see the movement in physicians' offices. You have medication therapy management, which is a pseudo way of insurance companies paying for certain patients to receive some consultation with pharmacists. So it's all over the place, which is why we see pharmacists dabbling all over the place, trying to build their own sort of entrepreneurial job out of these multi-variate reimbursement mechanisms. But I think at some point it starts to consolidate, and some people are starting to realize that appropriately placing a pharmacist and paying them appropriately is resulting in better outcomes for their patients. So if they're at risk, it makes sense to engage a pharmacist in the care of patients. So we're starting to see that. It's always a growth and a movement, and it takes time. But I think for the very reasons we discussed before, where the consumption rate of the older adult population is the growth in that population, these solutions are going to have to consolidate to some degree and provide some real opportunities.
Yeah, makes total sense. So the last question, Chad, for the show, if you had, one or two things that, you guys do a lot of education at ASCP, and, are really keeping your pulse on, what can really improve patient outcomes. If you had one or two things that were on your tick list for the practices out there that folks should be thinking about to really help impact, proactive patient care, what should be on the radar for, the rest of this year, next year, kind of down the road?
Yeah. And I hesitate to answer this way because it always seems like the wrong way to start. But the government and CMS for a long time has focused primarily on two things. And one is patient-specific care, and the other is value-based care. Yep. And I think pharmacists from a 50,000-foot view need to think about those two concepts. Now, in some ways, we're very good at patient-specific care. I mean, our whole acumen and experience is looking at 20 drugs in a drug class and determining which one is the right one for you based on, what kind of a job you have, what kind of a lifestyle you have. So in those ways, it's good. The value-based is really kind of emerging, where now hospital systems, long-term care facilities, physician groups are being penalized when they don't do a good job caring for people. So if they see a person go to the ER once a week, they're getting dinged for that in their reimbursement. And again, embedding pharmacists into that and making sure that they can play a role in reducing that patient from having to go to the ER so many times becomes a value-based solution that they can then market and use to go forward. So if I'm saying to a pharmacist in the next year and a half, what should you be focusing on? It's those two things. And that has a lot to do with digital solutions, technology solutions as much as it has to do with medications. So when I look at all the opportunities, you mentioned the adherence apps and a lot of things that are coming out to help people age in place. I look at those almost the same way I look at drugs, that, that's a great packaging system for this kind of a patient. That's a great application for medication adherence for this type of patient. And pharmacists have to be the ones that sit there and kind of look at all of the solutions and say, okay, you like to golf a lot. You like to, get up early. Here's the best situation for you from where to get your medications, how to make sure you stay on them. And that's sort of the magic of what pharmacists can bring is applying all this diversity in medications and in technologies and boiling it down to something that works for that person that's sitting across from you at their house, at the nursing home, at the hospital, wherever you're engaging them.
Yeah, that's so true. And that makes me think, there's so many pharmacy delivery companies now, right? And, depending upon, it can get super expensive, or some do it for free, whatever it may be.
Sure.
The pharmacist too, it's kind of interesting. It's like, oh, you live at home. Oh, transportation's going to be an issue. Like, let's consolidate these prescriptions instead of coming in 5 times a week,
right,
and get them delivered. So we know that you're not going to go 2 days without your, insulin, and your blood sugar is going to go through the roof. Right. I don't feel like, your local pharmacist, your retail pharmacist, because they want, or your national pharmacist for that matter, are doing, most people, if they're not tech savvy or they don't have somebody that's don't know that, hey, you could get your scripts filled, or, hey, this pharmacy, if you switch pharmacies, this pharmacy will deliver them for free. You don't even have to worry about transportation. Right.
Right.
So I think that those are some things too that, okay, why are you not being adherent, right? It's like, oh, well, you couldn't get a ride to, go get your scripts from XYZ big drugstore. So I think some of that will come into play as well.
No, totally agree. I mean, think if you look at the Amazon model, it's not any different than the retail big box pharmacy model of the past. It's put the pharmacy in the back corner of the building so that everybody has to walk through everything that they might want to buy on their way to get their prescription. And sometimes, you might get a certain prescription for free in order to walk out of the store and spend the average $150 on everything else that you're buying. And Amazon's no different. It's how do we get people to come to our website and get their prescriptions so that while they're there, we can make 20 recommendations on the things that they really need to buy. So pharmacists have to think in those terms as well. How am I going to be engaging to patients to get them the best possible outcome? What ways do I need to deliver myself and my services to them that they're going to consume it? They're going to desire to consume it. And I think focusing on being knowledgeable about all the things that are out there, again, digitally and medication-wise, and then being able to articulate that to a patient where it makes sense to them and says to them, wow, you really know a lot about me and you care about me, and I can see that this is the right technology for me. This is the right way that I need to get my medications packaged. This is how they need to come to my house. And these are the things I need to do to make sure that I'm successful taking them. I think that's the pharmacist of the future.
Yeah, totally. Well, Chad, it has been so awesome to have you on the show. Before we bring Ashlee on, tell everybody where they can find you guys, social, website, all that good stuff.
So you can come to www.ascp.com. That is the American Society of Consultant Pharmacists. We specialize in pharmacists that work with older adults and complex adults when it comes to medication management. We've been a national organization for 50 years, celebrating our 50th anniversary this year. We do have a website called helpwithmymeds.org that is open to the public that they can go to and then connect with one of the pharmacists that are members of ASCP. Yeah, personally, you can follow me at @ManageMeds on Twitter. And then I'm on LinkedIn and some of the other social media sites as well.
Sweet. Well, thanks so much, Chad, for being on the show. It has been a pleasure and so insightful. Ashlee, welcome to the show.
Hello. Thank you for having me. I feel like we're long lost friends.
Yeah, that's right. Did your show. Now you're doing mine. Awesome. Well, I want to get to kind of reel it back a little bit. You started your career as a pharmacist.
Mm-hmm.
Did you always want to become a pharmacist? Just tell me about the journey of what made you want to become a pharmacist.
Sure. Great question. A lot of people in pharmacy always ask me that. So I feel like I have this story nailed down pretty quickly because basically I was born and into pharmacy. I'm a third generation pharmacist. So, my parents were like, are you going to go to pharmacy school? Are you going to go to pharmacy school? Are you going to go to medical school or law school? Or what are you going to do with your life besides pharmacy? So it was kind of like the great safe path for me.
Right.
And I grew up around all aspects of pharmacy. My dad, who's a huge mentor, huge visionary to me, and not only to myself really, but just ultimately to the profession. He was super involved. So, I was going to like all the national organizations, statewide organizations. Like that was our family trips growing up. So I think I took my first steps in a pharmacy. So I've lived, breathed, and done everything around pharmacy, all different corners. So to answer your question specifically, I always knew I wanted to go into pharmacy because I grew up with my dad who loved the profession and who always just seemed super excited and happy about his career. But not only that, I knew I wanted to go in, but I knew that I never was going to wear a white coat. I knew that I had this feeling that I wasn't going to be doing direct patient care. I think I even wrote it in like my letter of intent to going into pharmacy school. There was never an earth-shattering moment that drew me to pharmacy, but I just saw the potential and I saw the opportunities beyond traditional pharmacy. So I did practice, I would say, traditional pharmacy in the health system per se. Never really did a lot of direct patient care, but I was in operations for a while. And then I transitioned into consulting for startup companies that were in basically developing technology for pharmacies, so pharmacy operations. So I did that for a while. And then as I was growing my own consulting company in the tech space, simultaneously, I had a lot of pharmacists and even non-pharmacists reaching out to me, healthcare providers, asking me how I started my consulting business. And I was like, I don't know, you just network and you just grow your brand and you just do it. And all these people just started looking at me like, what do you mean you just started growing a brand? Like, what does that even, how do you do that? And so I started to think like, there are people out there that don't know how to do this. And that's kind of what led me to the journey I'm at now, teaching people how to really stand out in a busy marketplace and how to grow your own brand, essentially.
So now you're coaching folks, you're doing stuff with USC on the career pharmacy, career strategist. Mm-hmm. So how are you helping people that are, traditional retail pharmacists, maybe they're consultant pharmacists, maybe they're have the background of being pharmacy and want to do something else? Like, how do you, there's obviously traits and goals associated with each of those roles. So how do you really talk to people about kind of those different silos and what really is right for them in that career?
Totally. So in the beginning, I would say a couple years ago when I launched my business as I would say a quote unquote career coach, like I was just purely in there supporting people through elevating their careers or kind of helping them navigate their careers because majority of people do it alone, right? We don't have a lot of support. Like we have bosses and managers, but ultimately no one's really objectively looking at a career holistically. So I was just helping people one-offs, kind of answering some tough questions. And then over the years, I realized everyone's kind of coming to me for the same question. Like everyone really wants help in navigating their careers or going through a career pivot. Now, everyone wants different things. So everyone has different goals and visions in mind. So ultimately what I did about 3 months ago now is I launched a membership where everyone can go and get the support that they need. So getting back to your real question, majority of times what happens is we are totally in our own way.
Right.
Like, personal obstacles totally hold us back. Imposter syndrome, scared, the fear, like what are people going to think about us? Oh my gosh, what is the pharmacy profession? What are my colleagues going to think? Like how weird is it if I put myself out there and I start saying I want to do these things? Non-traditional pharmacy is scary because it's somewhat unpredictable. Whereas what we were trained, 99% of the time, we're trained to go by, you go to college, you go to pharmacy school, you graduate, you get a job, you stay in the job, and like that's just how it is. But the truth is the marketplace is changing so much, so we have to go back to the drawing board. Like, so the marketplace is changing, so how do we keep up? And that's kind of what I've been teaching, not just pharmacists. So it started with pharmacists, but all professionals on how to really develop strategy in your career, because ultimately you could do whatever you want to do. Whether that has the word pharmacy in it or not is up to the own person, up to the own client. But I mean, I think it all comes back to figuring out what you really want, building clarity,
right,
and having a specific path and strategizing time and energy and support.
right.
So, because I mean, the people that are coming to me are all super, super smart, right? I don't get judged by people. Like I literally don't get people that are trying to just do, I don't know. Yeah, like nothing. All these people are super ambitious, super motivated. That's never been an issue. Like all really, really motivated people. It's really about giving the people the tools of what it takes to stand out. That's what we're lacking in pharmacy school and MBA school, graduate school. Not a lot of people are talking about this. So that's really what I think what it comes down to.
Yeah, that makes total sense. And I want to talk about, kind of going back to the topic of the podcast as we talk about the consultant pharmacists and how they can play such an active role in patient outcomes. And
totally.
So tell me a little bit about, as you're talking to folks, as, I know you do a lot of, you still practice and still do, manage medication and things like that. So how do you think the consultant pharmacist can really play that active role, especially with, all the seniors we have aging at home and, being this kind of virtual role and, more and more folks being in, acute care, hospital readmissions, are kind of through the roof, things like that. So where do you see that kind of today and in the future with some of, your experience and technology innovations and all of that kind of boiled up?
So such a great question. And I mean, to get into the weeds of pharmacy specifically, I just looked at some data a couple of weeks ago about, the United States government that in 2017 spent $3.5 trillion on healthcare. It's roughly 20% of our nation's GDP on healthcare. Of that, $330 billion was spent on prescription medications. Right. So we're talking about a lot of medications here. On average, 1 out of every 2 Americans, that's 50% of Americans, are on prescription medications.
Yep.
So, and there's no doubt, there's no bone in my body, there's no inkling saying like, don't know where the pharmacist role is. The opportunities are there. The thing with pharmacists and the consultant pharmacists and the breed and the type of pharmacist you are is you have to go out and get it.
Right.
And when you see a problem, you need to identify what the problem is and the skill that you have to fix the problem and to solve the issue.
Right.
So that's really what I help pharmacists with. I mean, I don't come up with the ideas, right? These are the people that are out there doing the direct patient care, seeing the issues. Now it's about coming to a solution of how can we help people? 50% of the country.
Right.
And actually even more data is talking about polypharmacy specifically. On average, if someone's on medication, the 50% of Americans that are on medications, they're not just on 1, they're on 4.
Right.
So,
and then seniors, it's even
and seniors is even more robust, talking about drug interactions and all the things. So, I mean, that is definitely not my area of expertise. I will be the first to say, like, there are clinical pharmacists. There are so many amazing, brilliant, talented, gifted, smart, educated pharmacists in the world. I'm just trying to help them execute what they want to do, their vision. Right. So there's no doubt. I've never doubted pharmacy. I've never doubted anything. It's really just about getting the tools and the techniques on how to really build an entrepreneurial mindset, even if you don't want to be an entrepreneur.
Right. So as you talk to pharmacists and we look at there not being enough beds for seniors, and we look at kind of the rise in home health, we look at prescription delivery, and we look at that role, kind of the ecosystem and the role that pharmacists now has to play not only with the patient, but with the caregiver. And as we look at, some of like the MTM where, and adverse reactions and, so much change when people are getting discharged from hospital, maybe they drop one blood pressure medicine and they have a new one. And,
totally.
There's so much confusion there. Where is that role for that entrepreneurial pharmacist to play in that ecosystem that really does impact that patient care
Right.
that maybe is not being looked at today in the traditional fill script, white coat, retail.
Right. I mean, the stop points are everywhere.
Right.
There's so many points of how we can help the patient. It's ultimately how creative and how flexible we are willing to do as a pharmacist to get into the weeds of where do we fit and where do we belong and what is our role.
Right.
Because talk about concierge medicine. I mean, there are brown bags that people go and take everyone's medications and deliver them right to the bedside. So there really is no doubt in the health system's perspective of, are they going to fill their medication? So that's one way. A second way, I mean, is obviously you guys have a digital platform, which is awesome. So you don't even have to be there. I mean, I think you're in Texas, right?
Yeah.
I mean, I'm in California. So there is no difference between how we're communicating right now versus if you were a patient of mine. So in today's era of technology and gosh, the apps that are out there and the crazy amount of digital opportunities, virtual opportunities, in my experience from working in other industries, it should be no different.
Right.
Access is access. So who am I to say this is the one size fits all solution?
Right.
It really comes down to the people that are in the weeds of that industry and what are they willing to do to fix the problem?
And you bring up a great point. You know, we typically think about concierge medicine as, you know, concierge physicians, and you pay your membership fee and you have this, you know, less of a patient to doctor ratio.
Yeah.
But you're doing some stuff in that space today. Explain how that works, the concierge kind of medication from the pharmacist side, you know, without giving the patient.
Yeah, I mean, just to be totally clear, I do not practice at all. It might be dangerous that if I practice. So, I mean, hopefully maybe in a couple of years, if I'm desperate and I need a job, I hope this isn't on recruiters' minds or anything. But I mean, I don't practice anymore. So what I focus on is how to help the pharmacist and how to amplify the pharmacist perspective to therefore directly affect the patient. So it's kind of like a ripple down effect. But I mean, for example, I'll give you a great idea. My friend Jessica, who owns Honeybee Health, not sure if you know her. She's awesome. She runs a pharmacy in Glendale, California. I think it's Glendale, California. But her amazing out of the box thinking, and you're going to have to bring her on the show because she's just so cool. She owns a pharmacy. It's an independent pharmacy, closed door. They do all mail order pharmacy, but it is a generic only, no insurance. They do monthly. It's like an Amazon-based service. So you pay like a monthly due, like, I don't know, let's say $50. And you get packages delivered to you, the medications delivered to you like a concierge pharmacy. That is genius thinking because that's really, I mean, I'm in like 10 memberships. You know, I have a membership. I'm in 10 memberships. So that is just really where it's going. I mean, healthcare is just somewhat a little behind in the sense of technology in my mind, in my experience. And if we could just keep up a little bit more and keep up with the modern day person, rather than trying to please everyone, get some type of audience that you want to support, whether it's indigent, whether it's whether it's overly qualified for healthcare, whatever it means. Not overly qualified for healthcare. I mean, they have a PPO and HMO, so they have plenty of PBM opportunities. It really just depends on where you think you fit in.
Yeah, and I think to your point, there's a lot of those services popping up that are doing that same thing, and they're even doing it with 2-hour delivery, or they're delivering to hotels for flight attendants, or they're delivering.
I mean, anything to make someone's life easier is a HELL yes to me. Like,
well, yeah, because I mean, if we were sitting here talking 2 years ago and it's like, hey, would you have all your groceries delivered? And when you have all your toiletries delivered, and when you have your scripts delivered, there's plenty of people that said no. People want to go to the grocery store. They want to see it. They want to feel it. And then you look at like us, busy moms. It's like, okay, if I can not have to load up kids, if I could not have to go down that route. It's the same. And I know we talked about on your podcast, it's the same with pharmacy. It's like, even with the drive-throughs,
no, pain in my butt. The pharmacists refuse to, and I'm going to get slack for this, but they can't leave the pharmacy so that they can't go get you OTC over the counter items, which is, I totally understand because they're super busy. But as a mom, I'm like, dude, I have to get out of my car to get, it's so annoying. So, I mean, I hate to say it, but that's trending out.
It is.
That's trending out. And I don't know if this is super controversial, but I mean, the truth is from a mom's perspective, like I have a million things to do. The last thing I want to do is sit there and get my daughter in and out of her car seat 5 times.
Right. Or go to the pharmacy, but then still have to go because you don't want to fight the pharmacy line. So you fight.
And it has nothing to do with the pharmacist itself. It's just the whole operation is not necessarily set up to succeed.
Yeah, exactly. Cool. So the last thing I want to talk about is, there's been a lot of talk that folks, not wanting to go into pharmacy school because they don't want to just be filling scripts, right? And so as you're advising, the students that you talk to, what's really the career advice that you're giving folks that are in pharmacy school of the opportunities that they have outside of retail pharmacy? So whether it's clinical, consultant, whether it's all these kind of new digital things, the Amazon-ish models of delivery, mail order. What's kind of your advice? Obviously everybody's different, but what's your advice on different opportunities that are out there for pharmacy school?
Such a great question because I get this probably every week. Here's the truth. I mean, obviously, depending upon who I'm speaking to, am I speaking to a pharmacy student or am I speaking to a pharmacist who's been out of school 10, 20 years? It's a little bit shaped differently. But as a student, you're much closer to the why you went into pharmacy. Yeah. I think majority of the time you have a light bulb moment of like, holy crap, I could do this. Mm-hmm. And there's opportunity here and there's impact I could make. I think what I'm finding myself doing is constantly reminding people of why did they select it and not having them pivot to where everyone else is going. You know, you don't have to do a residency. I did a residency and that was awesome and I loved it and it was fantastic. But is it the end all be all? Do I have plenty of other friends who are kicking butt in their jobs with no residency, with no second degree? Absolutely. And in my opinion, I think you have to consistently remind the student or remind the person who went into pharmacy is like, why did you go in and what type of impact did you want to make when you were in that zone? Yeah. And there's so much, like I said, all those data, you can't lie, the opportunity that's there. It's just getting the student to remember the impact that they wanted to make and letting them know that, hey, there might not be a job on this one street corner, on this one street, on this one in particular city, but the odds of the opportunity being there that you can create are amazing. And I think what we need to work on more with students per se is teaching them how to articulate themselves and thinking about, it's not just about the book, right? It's not just about learning the information. It's really about talking about the information. Yeah. Because what I say to people all the time too is like, it's one thing if you know something, like that's awesome if you are the smartest person in the whole entire world. But if you can't implement it and if you can't practice it, then there's almost no point of what type of impact would you have if you are just keeping it to yourself? So that's what I've been kind of talking to students about, and it's good. And then it's also, it's overwhelming to them because they want to know one path. Yeah. They want the answers. Black and white. It's not black and white. The marketplace, the economy is not black and white. Right. So we have to get comfortable being uncomfortable and going after that gray zone.
And I think there's a great opportunity because so many of the, millennials that are coming out of the pharmacy school and then soon to follow the Gen Zs, they're really about purpose, right? And they're about what are they impacting, right? Yeah. So when you look at the role of the pharmacist and where they actually can impact, it can be retail, but it's usually the independent or the community pharmacist. Right. But they can also be in that consultant role, that clinical role to really, get people off all these medications that pharma's driving them to, right?
If that's what they want. I mean, I think I totally agree with you. I just think we need a lot more rebels in this industry, and a lot more innovators, people who are willing to really step outside their comfort zone and just put their head down and work and just do do what we need for the patients. It's all centered at the core of patient care. So,
you said my words that I love: being a rebel, being an innovator, disrupting industries. All my introductions usually of what I do.
I dig it. I mean, it's definitely not easy. I'm never saying it's going to be easy, right? That's why I believe in investing in yourself and getting the support that you deserve. I'm in mastermind groups. I'm in entrepreneurial groups. I'm in people's people have my back no matter what. And I think it's so important that when you're being visible and you're trying to do something new, that you really understand that you don't have to do it alone.
That's awesome. Well, Ashlee, before we go, tell everybody where they can find you, follow you, ping you, all that fun stuff.
Thank you. So my biggest thing right now is Instagram. I don't know. I'm loving that platform. It's super creative. It's super fun. So you can follow me on Career by Design. And then obviously LinkedIn is Ashlee Klevens. You can just reach out to me, say what's up. And my website is rxashlee.com with 2 E's. So
yes. All right, cool. Click on that in the show notes. Also want to thank Chad for being on the show earlier. This podcast has come to a close. Ashlee, thanks so much for being on there.
Thank you.
Remember to subscribe to get your shows weekly. If you have any questions for Ashlee or Chad, feel free to submit those and we'll get you the answers. Thanks for being on the show.
This podcast has come to a close. To hear more from the Executive Innovation Show podcast, subscribe, submit questions, and share the love. Follow us on social. We're everywhere.